Thanks for joining us today as we announce the expansion of the Northland Emergency Center. We're very pleased about this expansion, and where we're standing today will look very, very different by February of 2013. Our Northland Emergency Center is one of the busiest emergency rooms in the city. We see 65,000 patients a year. This facility is designed to grow with our community. We hope to be able to serve at least 80,000 patients a year when this facility is completed. Many of those patients require CT services, and we're going to have a CT in our emergency room, which will help with patient flow both in the hospital and the emergency department itself. During the construction, we'll be open for business, continuing to be the busiest emergency room in the city. But we will have some extensive renovation in the current emergency room as this project completes. But as you will see and understand, this project is primarily an expansion out. Where we are today will be part of the new emergency room. Clay Edwards Drive will move. The heliport will move. So you're going to see a fairly substantial expansion out in this area of the hospital. So actually, when we're completed, much of the existing hospital will not be part of the emergency room when we're done, but we have to phase it in this way so that we can stay in operation. The helipad will relocate closer to the ER, so we won't have to close Clay Edwards Drive every time they need to land. We'll have 42 patient rooms, but they'll all be large and private rooms, which will make a big difference to our patients' privacy, safety, and their care. Other features to keep our patients in mind: we will have a quick treatment area for those with minor emergencies who can come to the emergency room, be treated, and get on their way quickly and not have to get away of the more serious patients and the traumas that come in. This project's going to cost about $16 million when it's completed. And any project of this size requires tremendous support from our Board of Trustees.
As more and more people move to the Northland, they count on our services. And unfortunately, when emergencies happen, they have to come here, and we'll stand ready to meet those demands. With our Level 2 Trauma Center, we can care for most critical injuries. With our new expansion, we'll be better to meet those requirements as the increases of need continue. As chair of North Kansas City Hospital Board of Trustees, we are proud to support this project. We look forward to the completion of this wonderful facility. I must thank Jerry Huseman, our Vice President of Facilities, and his entire team for their hard work and diligence.
This will be my 5th ER here. I was here as a patient in 1970, I think, when I was 14. Worked my first shift in the ER in 1983. It's currently where Charlotte, I think you're the only one that's old enough to remember the original ER, which was down toward the medical staff office. It had maybe 3 beds. Then the next ER was where our current B side is, and it had maybe 11 beds. Then we've renovated a couple times since then, but always been constricted by columns and electrical panels and this and that. This time we're going to get it right and make it a truly good functioning ER.
I was having the big one. I was in full cardiac arrest. And Dr. Jones, Dr. Russell, I don't think you were here that particular day. There was a doctor from cardiology that happened to be in the ER department, Dr. Jones. You know, some heroes, they had Lady Gaga, Tiger Woods. I tell you, Dr. Jones is my hero. Dr. Jones greeted me not with a handshake, and I hear all of this later. He greeted me with a carefully directed fist to my sternum. I was told later that I was in real trouble. And that was the quickest way Dr. Jones could get me going again. And it worked. But in my about hour stay, I needed to be shocked 3 more times. Dr. Jones and the ER staff made a critical decision. You see, North Kansas City Hospital is one of the few hospitals that actually uses what they call hypothermia. It's new, it's cutting-edge therapy to treat people in duress and cardiac arrest. And what they do is they basically lower your body temperature. And I learned later that's to save your brain. Now, I will tell you, there are some friends and probably a few family members that say that that piece of it really didn't work. But thank goodness it all worked. And as a member of the community, I want to thank the city of North Kansas City, Mayor Biggerstaff, the hospital board, and the wonderful staff of North Kansas City Hospital for their vision. Whether you're fixing a broken finger or saving someone's life because they have cardiac arrest, your vision statement of providing hope and healing to every life we touch certainly was true for me.
I had a heart attack March 17th of this year, and I was out for, I don't know, 15 or 20 minutes. And my co-workers, they did CPR on me and stuff, and North Kansas City Hospital came pick me up, and I was put on that cooling down bed for lower my temperature to 88 degrees for about 7 or 8 days. And I had open heart surgery last June the 2nd, and I feel pretty good.